A review on this book, The Illness Narratives, Suffering, Healing, and Human Condition, written by Arthur Kleinman. Arthur Kleinman is a psychiatrist and a social anthropologist. He has authored several books, and our book of discussion today is his first book, which was written in 1988. He has co-edited a few other books published in other journals. Author has always been passionate about psychological and social aspects of chronic medical illness. But in one of the interviews in 2006, he discloses his asthma, his hypertension that never affected him, his wife's neurodegenerative disease, which ruined her vision, has affected him. Currently, he's writing a book on caregiving. He has been involved in clinical and ethnographic studies across China and North America. Narratives around illness were written or became popular around mid-20th century. Social and cultural events around that period kind of created an environment which was conducive for such narratives. There were quite a few memoirs which were published. This book, however, has several sensitive narratives included in it. The source of these narratives was transcripts of audio tapes and author's notes during clinical research. Through this book, author wants to popularize a technical literature that would be great for anyone who has to live, make sense, and care of chronically ill. He argues on how important it is to learn to interpret patients' and families' perspective on illness. He argues interpretation of illness is a core task of work of a doctor. The book is for a broad set of audience, just not for a group of experts. In the first few chapters, author sets out differences among illness, disease, and sickness. Illness is patient and family's perspective. Disease is the problem from practitioner's perspective. Sickness being macro social aspects shaping illness. We are used to seeing this process of perceiving body as a distinct entity, a thing, an it, separate from emotions and thoughts. Medical training these days involves patients coming with illnesses. Doctor then, through careful listening, labels them with a disease. Author, through this book, brings our attention to non-Western cultures where even today the body's complaints are still perceived to be result from deviation in either family, social, culture, or moral problems. Time and again through the book, our attention is brought to the issue of looking at illness only from a biomedical aspect. Author says illness is polysemic or multivocal. Illness may mean different things in different contexts to different people. Author has described chronic illness in quite lengths as one of the most complex illness. He then goes on to describe chronic pain and suffering through various narratives. The book just does not have gloomy examples, it also has inspiring moral heroes. He provides examples of various stories that patients bring to doctor that make sense only in the context of their lives. Cultural issues are allowed to slip by one after other. But if the same thing were to happen with biological issue, it would be considered sheer clinical incompetence. Suggestions like assisting patient die a good death. For practitioners, an inquiry into illness is a journey into relationship. Care of chronically ill is difficult. Frustrations from trying multiple treatments, countless tests without obtaining desired result, tires both practitioners as patients as well. Author talks about making changes in the training of doctors is quite essential. There are boundaries that exist in today's healthcare with patients' physical and social issues dealt differently, and they need to align. What we found from this book is not so much of a new idea as such, but a better perspective of disease and illness. It reinforces the importance of doctor-patient relationship. This book made us realize there could be a better way of interacting with patients and their families that can help at looking at holistic approach towards individual health. We think there's a need for updating the book to current times with definite consideration to fleeting and migrating populations. People are bringing this wealth of different perspectives to community through their training and knowledge, and also facing challenges of working in a foreign country. If we could only combine this information, collaborate, and bring a humane approach to health, where no person could lose their identity. We could model an updated and a more balanced health system. Part of responses about this book. This provides a valuable insight. We were unable to find tools that addresses the problems, however. Current situations where we have large number of patients to be seen, doctors being limited on the availability of time for each patient, how do we address this narration of illness? That was one of the questions we had as a team. Some doctors lack the quality of personal interactions. Some healthcare professionals think of themselves superior as they know how to fix a health problem, but it does not necessarily have to mean they're fixing the problems of the patient. The implications for healthcare of what we see in Australia. It's a great opportunity for healthcare providers to reflect on their clinical practices, just not in Australia though, but it could be anywhere around the world. One of the Australian government funded project, which was Real People and Real Data, which collected the literature and the practice reviews around the narratives to drive a better health outcome, has come up with tremendous ideas. They've identified aspects of what counts for a good experience in healthcare setting. So these are a few of the things that the recommendations were made in the framework. We definitely recommend this book for everyone here. Most of those who have reviewed the book have given positive remarks, like how the book should be a necessity for students of public health, medicine, or healthcare management, which aligns with what we think. Almost all who review the book have pointed out the book has the power to inform not only their perception, but also in their road to recovery. However, others have remarked that implications of this book to healthcare is not the answer to the rising costs and access to healthcare, as this would require more time on patients' consultations and by the physicians. My team members also have different views about this recommendation, so I'll pass on to Charlotte.
Thanks, Shubha. So what I've learned from this book is that this helped me to reflect that patients' lives depend on all the healthcare staff involved in improving patients' health. So in my profession, I would say that this has improved my motivation to perform my job well in analyzing patient samples, because any wrong results given to the doctor for interpretation could mean the improvement or the miss of the patients. So basically, it's all about realizing the implications of how a quality laboratory service could help in the effective delivery and the overall quality of care given to patients. So Himata, do you want to share your views as well?
Thanks. I would definitely like to share my views. While reading this book, I have come to learn different tales of the people suffering from chronic illness and how the healthcare staff had supported the patient's unique journey towards wellness or death for that matter. This book enabled me to understand the meaning of illness and how patients cope up with their unique situations. With this new knowledge, it gave me a new perspective on how to provide psychological support to the patient through patiently answering their queries. I would like to recommend this book.
Thanks, girls. So that's definitely why we are recommending. It was, of course, it helped me the importance of being patient, more respectful and thoughtful of where patients come from and where they present. But together, yes, we do conclude it would be helpful for anyone to get benefits out of this book. It recognizes the importance of looking beyond current medical training. It will broaden your understanding about different countries and patient presentation and implications. It would sensitize you to know more about natives and foreigners' idea of health and illness, so our management can be more contextualized. It will give you an opportunity to reflect on your own training. We definitely suggest you read this book and other similar books, which could then help you to make an informed decision on how you want to influence your patients and their families in future in public health.